So on to the matter at hand. I warned you that understanding why the U.S. is attempting to transition to value-based care is not a happy discussion. The headlines on this slide tell much of the story. The first two headlines, U.S. spends more on health care than other high-income nations, but has lower life expectancy, worse health, and our infant mortality rate is a national embarrassment. Reported on a study conducted by the Commonwealth Fund in 2015 that the U.S. spends more per person at $10,345 on health care than any country in the world, while seeing the lowest life expectancy, poor rankings on infant mortality, and some of the worst health outcomes among this group. Now, this group is a small group of countries. Not only are average costs much higher in the U.S., but our total expenditure of $3.2 trillion on health care in 2015 means we spend close to 18% of our gross domestic product on health care, which is about 50% more than any other country, and it is rising. Life expectancy is commonly used to describe health outcomes. In the U.S., in 2015, which is the latest data I can find, life expectancy was 78.8 years, where Switzerland had a life expectancy of 82.9 years. Another measure that is commonly used is infant mortality, which is defined as death of a baby before first birthday. With the U.S. at 6.1 infant deaths per 1,000 live births, which is significantly higher than other countries, not all, but many, and including countries such as Belarus and Cuba. Researchers exploring this segment for the U.S. observed that infant mortality almost entirely occurs in less advantaged groups. In comparing all high-risk births, for example, it is clear that the U.S. has the best neonatal intensive care units. But once such infants are sent home, poor, less educated, and single-parent American families are found to have considerably less access to quality health care, often resulting in infant deaths. The 2014 article from the Commonwealth Fund, that title is U.S. Health System Ranks Last Among 11 Countries on Measures of Access, Equity, Quality, Efficiency, and Healthy Lives. This reports on the most currently available data to 2011 for 11 countries, including the U.S., UK, Switzerland, Sweden, Norway, New Zealand, the Netherlands, Germany, France, Canada, and Australia. The U.S. ranked third in effectiveness of care, fourth in patient-centered care, and fifth in timeliness of care, but last in cost-related access to care, efficiency, equity, and healthy lives. Overall, the U.S. ranked 11 out of the 11 countries, with the UK being first and Canada just before us as 10th. Efficiency, as described in the Bloomberg article with the headline U.S. Healthcare System Ranks as one of the least efficient, refers to being able to produce quality outcomes at the lowest possible cost. In the Federal Health IT Strategic Plan for 2015 to 2020 that was released by the Office of the National Coordinator for Health IT, we call it ONC, CMS was described as having 4 goals to improve efficiency: high quality care, lower costs, healthy population, and engaged people. Well, on a lighter note, we might suggest that TV drama often reflects or at least suggests future reality, sometimes blatantly and sometimes more subtly. Viewers of the New Amsterdam TV show on NBC this fall, who are focused on value-based care, may recognize that the show is covering many areas where value-based care can improve our healthcare system. So far, I've seen addressed, alluded to, or insinuated polypharmacy, overworked staff with drug and workaholic addictions, social determinants of health, and diversity issues. We need to address the fact that more than one-third, or 37%, of U.S. adults do not access a diagnostic test, treatment, or follow-up of care because of cost. We need to consider the amount of time and money spent dealing with insurance, lack of communication among providers, and duplicative medical testing, often done as a result of medical malpractice concerns. We know and are starting to address that 40% of adults use emergency services when they could be treated by their physician, except for the fact that he or she is not accessible. Equity issues are also evident in length of time waiting to see a specialist, waiting for emergency care, and delays in care due to insurance prior authorization requirements. U.S. healthcare fragmentation, lack of organization, and not coordinated care also lead to inefficiencies such as repeat diagnostic studies, delays in treatments, medication errors, and others. Poor outcomes are believed to relate to social determinants of health, such as how we eat, poverty, inequality, and lack of social support. However you may weigh in on health reform initiatives in the U.S., and we're not going to discuss the politics in all this, it is clear we need more effective solutions for such as the following recent scenarios. Cost and use of prescription drugs increased 12% between 2013 and 2014, while there was also a 60% increase in prescription drug advertisements between 2011 and 2015, and of course leading to the opioid crisis. Hospital ownership of physicians has grown to the point where less than half of physicians are independent, either being employed by a hospital or their practice owned by a hospital. Specialists earn by far more money than primary care physicians, even though primary care physicians present the best return on investment for hospitals. Interestingly also, though, is that primary care looks like it's going to be replaced by digital technology, other clinical professionals, and convenience care, especially in the younger generations. Availability of behavioral health professions is at a crisis point. Consider that plastic surgeons are among the top 5 highest paid, while psychiatrists are in the lowest 5 for earnings. Integration of behavioral health and primary care is proving effective, but privacy, licensure, and insurance issues, as well as availability and use of these providers, are barriers. Even male and female physicians have their own civil war waging over pay and quality of care, and much more diversity in health care is needed.